The World Health Organization defines mental health as a state of well-being devoid of mental disorder. In Nigeria, studies have shown that the prevalence rate of mental health cases is between 20 and 28% for diagnosed psychiatric conditions. This implies that at least 25 million Nigerians are exposed to mental health services benefits in the country.
Every day, 24/7, we register a minimum of not less than 15 to 20 new cases. So there's a volume of people that come to Yaba every day.
Though the challenges of mental health delivery cut across countries the world over, Nigeria has peculiar shortcomings. Recent studies reveal that only 10% of those with severe mental illnesses receive treatment, as there are only 4 psychiatric hospital beds per 100,000 people in the country. Nigeria also has only 8 psychiatric hospitals that are grossly underfunded. Brain drain is one area the country loses trained psychiatric nurses and specialists who ordinarily should take charge of the primary health care-based services.
Consultant psychiatrists, we are about 160, and those that live in Nigeria are less than 100. We're talking about 1 consultant psychiatrist to 1 million Nigerians.
Research shows that there are more Nigerian psychiatrists in Britain than in the country. Stigmatization has remained a major factor militating against effective mental health delivery system in the country.
They believe once anybody who is in the field of psychiatry is actually also, in quotes, mentally unstable as their patients, which is actually not true.
Some respondents would rather seek spiritual help to tackle psychological problems.
So there's nothing God cannot heal. He can heal mental disorder. So it is always available for people who believe in God.
Depends on the level of faith of the person involved, not necessarily spiritual help, but seeking for the elders of the church.
Apart from addiction to alcohol, smoking, and depression, mental health challenge also affects children.
Studies have shown that roughly 1 in 5 children have some recognizable mental disorder or the other.
You will begin to notice signs of mental illness by the time a child is around 3. Any chance of that child not developing as his or her peers, an indication of mental illness should be suspected and should be treated right away.
According to World Health Organization reports, 1 in every 5 women who give birth experiences post-birth depression.
As mothers, most of us went through what we call the puerperal bruise. Within 24-48 hours, we have this, irritability. You don't want to touch your baby. You are just angry. If it prolongs more than that, you start seeing yourself feeling sad, not sleeping well. And some people even go to the extent of even planning to kill the baby. So if you don't arrest it at that stage of depression and psychosis then comes in, it becomes more difficult.
Depression, doctors say, often leads to severe mental problems. So, how best can it be managed?
Whatever situation you find yourself in, try and be calm, smile a lot. Don't be angry.
Well, these respondents have devised a way of dealing with depression.
I learned one thing while I was growing up in life. Whatever you cannot take care of now, let it go. Don't roll over issues. Step over issues so that your focus can remain in focus.
Psychiatric specialists say there is need for a national policy on mental health service delivery, as the existing legislation was adopted from the colonial laws of the Lunacy Act of 1958. The consensus is that equal attention or even more should be paid to sensitization programs, and more mental health care service delivery system should be established at the grassroots level.